Kumar Barve. I'm joined by my vice chair, Dana Stein. Members of the committee are filtering in. Let me begin by announcing the order of the bills. Ordinarily, we do them in numerical order, but a member of our committee decided, asked to go first, and I granted that. So the first bill is going to be House Bill 964, Delegate Parrott. The second bill will be 279, Dorchester County Delegation. Third is 886, Delegate Jazz Lewis. Fourth will be House Bill 912, Delegate Lasanti. Fifth bill will be House Bill 945, Delegate Wells. And the last bill then today will also be Delegate Wells's bill, and that will be House Bill 947. So let me get the witness list for that bill. Okay, so we have House Bill 964. Delegate Parrott has a PowerPoint that he'd like to do. So I'm going to time him on my phone. This will be 4 minutes. So Delegate Parrott, please proceed. And you'll need to unmute yourself.
Boy, that's the trick. I need to do that.
Yeah.
Thank you, Mr. Chairman and committee. It's great to be with you this afternoon. And I do have a great bill that you're going to like. It basically means if you're on the interstate highways and a rural interstate highway, that you need to stay to the right if you're going slower and only be passing on the left side. We've seen this one before, but I think this is the year that we can get it through. I'm meeting with other groups that I think are going to maybe not be supportive, but not be opposed to this bill. So I think it'd be great. I am going to try and do a slideshow, if that works, which...
3 minutes and 36 seconds, Delegate.
Very good. All right. Are you seeing my screen? No. Oh, no. It's been disabled, the host sharing screen thing.
Uriel, do you know how to undisable that? Because I don't.
Yeah, it should be good now.
Somebody did it. All right.
There we go.
From the beginning.
Okay, I'll resume. Let me just start and I'll resume the clock.
Great. Can you see the, I guess what I'm showing on the screen then?
Yep, I can see everything. Yep.
Excellent. Okay, great. So this is House Bill, of course, 964. You know, there was a song about this, and it's a universal truth that those traveling slower should generally stay on the rightmost lanes, allowing the fast drivers to pass in the fast lane. Of course, so I talked about the bill a little bit. What it does is in rural areas encourages drivers who are traveling slower than the general speed of traffic to stay in the right lane. And the key here is encouraging. There is no penalty at all if you go slow in the fast lane, but there are going to be signs, and we're going to encourage people and educate people that that's really what we need to do, is keep that lane clear. It increases safety. I'm not going to go through all the statistics, but the bottom line is when people know what to expect and they're not weaving around each other, we are increasing safety on Maryland roads, and that's a big reason for this bill. Of course, research shows that cars riding side by side, if they're going the same speed, they can result in major backups. And you might remember from the 80s, on I-95, the police had rolling roadblocks going 55 miles an hour, and you had miles and miles of backups. That really interfered with the free flow of traffic. And that's why I want to keep people who are going slower to stay to the right, to keep the left lane free, so we can avoid those backups. Let's see. Huh. All right. Here's the next slide. Of course, the more congestion, the higher the risk of crashes. And we want to, again, keep people on the right who are not passing. You can see here's just a picture of showing the fast lane or the passing lane. Of course, road rage can be an issue. I'm going to make sure we don't go over for 4 minutes.
You got a minute and a half left. Yeah.
Minute and a half. Okay.
Yeah.
Can be avoided if we just keep people to the right. I did talk to Delegate Bill Folden. He wanted to be here again this year. He does support this bill, just so you all know, but he won't be testifying today.
Oh.
Yes. Again, how would it be enforced? Well, it's not enforced. We're just simply asking the state highway to put up signs and even use the variable message signs that are up in place already, to ask them to just display that message as long as it is fine with them. So here we go. Other states, a lot of other states have this. You can see in the yellow, those are the 29 states that have this as law, and you're punishable. You can get tickets for this in all those other states. And that's one reason I think this bill is helpful, is it allows Maryland drivers to be educated so that when they go to these other states, they won't think that they can be in the left lane and go slow, and they would get that ticket unexpectedly. Of course, this is just courteous behavior. We're allowing people to pass. And so by voting for this, we're going to create a safer interstate system in Maryland. We're going to reduce congestion, and we're going to encourage more courteous driving, but we're also going to educate people when they go to these other states so they won't get tickets. And with that, I just ask that you vote favorably on House Bill 964.
Okay, and you did that with 9 seconds spare. So I have a number of questions. Let me see who had their hand up first. Hold on. Okay, DFH, then Delegate Ruth.
Delegate Parrott, I have 2 questions for you.
Yes, sir.
Number 1, and you probably already know what this question is. Do you have a cross file?
Do not have a cross file.
Okay.
But I am talking to interested groups.
Okay,
I have
but
a
you
meeting
don't have
scheduled.
anybody sponsoring this bill over on the Senate side.
No.
Okay. Actually, those are all the questions that I have. Thank you.
Okay, Delegate Ruth.
Thank you, Mr. Chair. Delegate, just a quick question. Why only rural areas? I mean, this seems like the kind of thing that would be useful on, let's say, 95 as well.
You're right, Delegate. We could amend it to make it for all interstate highways with 3 or more lanes. The reason I focused on rural interstates is because that's where there's typically free flow traffic all the time. And so it would be most useful in those areas. And when the state highway first went to 65 miles an hour as the top speed limit, of course now it's 70, but in Maryland, they only did that in the rural interstates first. So maybe we start there and then go to the urban. That was my thought on that.
Thank you.
So I've got a question, Delegate. Let me just be clear that I know what you're doing here. Basically, you're making it the law for sign posting and encouragement, but nobody is going to be pulled over and written a ticket?
That's correct.
Okay.
Yeah, it's
well,
not a secondary offense. It's not a primary offense. Even if you're pulled over for something totally different, you can't get a ticket for this.
Okay. Nobody has signed up in opposition to this bill, which is interesting. It'll be the first time that we will have been able to have said that. So, okay, any other questions? Dave, you still have your hand up. Okay. Well, okay. You made it out of committee unscathed, Delegate Parrott. Oh, wait a minute. Hold on. Delegate Healy has a question.
I do. I just wondered if there's any other, if Delegate Parrott could tell us if there's any other kind of situation in Maryland law where we just make suggestions to people of how they should behave and not have penalties.
That's a good question. There is one that I can think of right off the bat, and that's kids on bicycles. They're supposed to wear that helmet whenever they're on a bicycle, but it's completely unenforceable in the law.
Is it written into the law that it cannot be enforced?
I would have to check, but I think it is. I think it was pretty clear when they passed that they wanted everyone to wear the helmets who were, I think it's 15 and under, but there was no ticket, no fine, nothing that they would do.
Okay, thank you. Appreciate it.
Thanks.
Any other questions? All right, you have made it unscathed out of the committee. Thank you very much. That ends the public hearing on House Bill 964. We'll proceed to House Bill 279, Dorchester County golf carts. Who's here to represent for this bill?
This is Delegate Chris Adams, and Mr. Chairman, I'm here to present House Bill 279. It's cross-file in the Senate. SB 312 is passed, and I believe it's in your committee's hands now. To make this brief, because I'm sure you're busy today, we're asking this bill to be applied to Hooper's Island, Taylor's Island. These are two rural small towns in Dorchester County. The golf carts can only be used on roads that are 30 miles an hour or lower. You have to have a driver's license, shall be equipped with lighting devices for visibility. And I am asking for the committee's favorable report and will not go on unless there's questions. Thank you, Mr. Chairman.
Excellent testimony. Does anyone have a question? I don't see anything for right now. Yeah, it appears you also have made it out of my committee unscathed. There's no negative testimony. So, okay, so that ends the public hearing on House Bill 279. We will now go to House Bill 886, Jazz Lewis. Welcome, Delegate. If you're there, you're there. Okay. Uh-oh. All right.
Thank you, Mr. Chair. May I begin?
Yes, you get 4 minutes.
Thank you. The Chair Barve, Vice Chair Stein, and the members of the House Environment and Transportation Committee, I urge a favorable vote on House Bill 886. WMATA has instituted several safety measures to improve service delivery for workers and customers over the last decade. In 2012, following the U.S. Senator Barbara Mikulski's lead, a new federal law requiring that states with rail transit systems identify or establish a state safety oversight agency in their state to ensure that all rail transit system within their borders adhere to a new safety framework. The Commonwealth of Virginia, the state of Maryland, and DC joined together to craft an agreement creating the Washington Metro Rail Safety Commission, which was charged to oversee the WMATA rail safety system. Because of the multi-state agreement's unique nature, Congress needed to formally approve the compact, which it ratified in August 2017. The WMSC began directly overseeing the Metro Rail system safety on March 18, 2019 upon receiving federal certification. Unbeknownst to many legislators, when we passed the WMSC, we left in statute oversight of elevator regulation and auditing with Dollar. This has created a regulatory framework where WMATA now has two regulators as it relates to the elevators between Dollar and WMSC. The state contributes financially to WMSC, and our Secretary of Transportation is on the board of the agency. WMATA believes that double regulation is unnecessary and creates difficulties in deciding which regulation to follow. Since introducing the bill, I've heard from the International Union of Electrical Constructors Union about potential concerns regarding Dollar no longer being the primary regulator. We're working with IUEC and WMATA to address their concerns. Thank you for your time, and I urge a favorable vote.
Okay, terrific. We have a number of people signed up in favor of the bill. Charlie Scott, Mitchell Nisi, I guess, and Brian Williams. So why don't we go to Charlie Scott first, and then Mitchell, and then finally Brian Williams. So Charlie.
Yes, thank you, Chairman Barve. Yes, thank you. Chairman Barve, members of the committee, thank you for the opportunity to testify. I also want to thank Delegate Lewis for sponsoring this bill. As Delegate Lewis just went over, there's good policy rationale for this legislation. Again, it addresses some redundancy now in state law regarding double oversight of this component of our rail system, and also addresses potential conflict if there ever was a situation where Metro was receiving conflicting guidance from either WMSC and or Department of Labor for our escalator elevator regulation. As Delegate Lewis mentioned, we have heard some concerns from professionals in the industry represented by IUEC. They recognize that WMSC is a recently established entity. It's about 2 years old now in terms of operations. And they recognize that Department of Labor still has relevant expertise for this specific elevator escalator component of our system. So we are working with them on potential amendment language that would still retain WMSC as the primary regulatory oversight agency, which they need to be, but also provide that Department of Labor would still have the ability, right, to audit our system, audit the escalator, elevator functions within our system, our rehab replacement program, our maintenance program, our inspection program, anything that they deem necessary. And then the way we would propose it would be that any findings reports would go to both the WMSC as well as to WMATA, and we would work to address any findings from such an audit. So with that, I hope we can come to some resolution with the other industry professionals, and I urge a favorable report. Thank you.
Thank you. Next is Mitchell. I think your last name is pronounced Nisi. Is that correct? Did I get it?
It's Nietzsche, but that's okay.
Nietzsche. Oh, of course, one C would be a ch sound. Right. Okay. Go ahead, Mitch.
So thank you for the committee and everybody's time for hearing us on this bill. This bill is basically about maintaining safe and reliable transportation to the residents of Maryland. Years prior, for many years, we had an MOU with DLLR in the state of Maryland where they oversaw our in-house inspections group, and they audited us. In 2019, that law changed and did not allow us to self-inspect anymore. How it relates to the people of Maryland is that we can respond 24 hours a day, 7 days a week with qualified, certified elevator inspectors. Inspectors who have many years of experience inspecting for code on behalf of the state, elevators and escalators, and especially escalators because they are a niche machine. And the state of Maryland, if we have to wait for them to come out, if an accident happens on the weekend and we have to wait for them to come out, it could be 3 days before they respond if it happens on a weekend. So if that was the case and another escalator was to go down at, say, Wheaton or Bethesda, that would mean that we wouldn't meet egress calculations, meaning that the trains would have to bypass the station, leaving the community with no rail service. And it could be for a couple of days. So for that reason, we hope for a favorable outcome. And if you have any questions, I'll take them at this time.
Okay, no, well, first we'll listen to Brian Williams and then we'll take questions for the sponsor and all the proponents. So Brian, you're up next.
Thank you, Mr. Chairman. I am Brian Williams. I am the compliance manager for the Department of Elevator Escalator Services here at WMATA. Thank you to Delegate Lewis for introducing this bill. I'm not going to rehash and repeat everything that Mr. Nietzsche said. He hit it right on the head. The purpose of this bill is to allow us to be able to once again conduct our inspections in-house as we did prior to 2019. We can respond more quickly, we can be more agile, and we can get service restored to your constituents at our high-rise stations if a need would arise to do so. So with that said, I'll take any questions you have.
Okay, looks like our internet service here in the House office building is on the blink, sort of. I notice a lot of the screens are blank, but anyway. You have a number of questions, and I think the first goes to Delegate, here we go, Delegate Wells, then Delegate Clark, then Delegate Terraza. So Delegate Wells.
Thank you, and thank you to the bill sponsor. So, well, one, it's good to hear the IUEC and the IBW you're in conversation with them. But I guess my question though is just kind of is regarding overall safety. It's my understanding that there was a culture of oversight with WMATA in terms of overall safety. I'm not just speaking about elevators and escalators. And so I just would like to understand how that culture has changed, because it was my understanding that a lot of things are being brushed under the rug. There was kind of a culture of intimidation. So I'm just wanting to make sure, like, what steps have been taken to ensure that that in-house inspectors won't continue to use the behavior that required folks to step in a couple of years ago. So whoever wants to answer that.
Sure, this is Charlie Scott. I'll take that from the agency overall perspective. So definitely, I think that is an issue that we've been addressing. Our general manager has been addressing that, Mr. Wiedefeld, as well as our board establishing a chief safety officer. And then also, I think, as Delegate Lewis mentioned, the WMSC was a result of actually a tragic accident on our system back in 2009, Senator Mikulski was very concerned about transit safety at Metro, but also across the country. So the establishment of the Metro Rail Safety Commission really resulted from that federal requirement that Senator Mikulski pushed in Congress. So that has also resulted in renewed focus both at Metro as well as transit systems across the country to prioritize safety. So I'll let Mitch or anyone else address more specifically within our elevator escalator system, how that works.
Well, within our elevator escalator department, we operate as an independent entity. So the way that works is I am in charge of that inspection department. I have an assistant manager who runs it. All of our inspectors report directly to her. We operate with no influence from our maintenance department, which are the people that are responsible for the care and upkeep of the equipment. They do not have any say whatsoever in what we find on our inspections. Our inspectors have the ability, and do when need be, to take units out of service, to lock them out so that they can't be used until we go back and certify that they're good to run. That's how we've always functioned. The reports you heard out of Metro, as unfortunate as they were, none of those were related to the elevator escalator department. I understand your concern. We have always operated that way. This is something we take very seriously in our department.
And I just want to add a quick note to what Brian said, that our inspectors actually have the ability to lock and tag equipment out for violations. A third-party elevator inspection company does not. They have to report that to the state to make that decision.
So I just have one quick follow-up question.
Go ahead. Yeah.
So the quick follow-up, the question I have is, I may have missed this, so forgive me, but I just want to understand, would this completely remove any third-party inspection altogether, or only for certain types of inspection and maintenance needs? Can you just clarify that?
This would remove third-party. Previously, like I said, we had an MOU with the state of Maryland for many years where we self-inspected. But this would remove the new third-party law that just went into effect recently.
Are you good? Okay. Next, we have Delegate Clark.
Thank you, Mr. Chairman. This is a question for the gentleman from WMATA. So this bill would remove the state's ability to have any inspections and oversight over all the elevators and escalators that are operated by WMATA? There wouldn't be any inspections at all?
So the way the bill is introduced, it would designate and recognize Washington Metro Rail Safety Commission. The amendment language we're talking about would actually still authorize Dollar to come in and audit our program and then report their findings to the Safety Commission.
Are there any other transportation systems that operate in the state, whether it be Amtrak or anything like that, where the state doesn't have any oversight on escalators or elevators?
So right now, the state doesn't have any oversight for any federally owned, operated escalators and elevators.
Okay, and one last question. I assume that you all have put together some type of manuals or some type of specifications for the standards and the process for overseeing the elevators and the escalators on a regular basis.
That is correct.
Okay, thank you very much.
Okay, next, Delegate Terraza.
Thank you, Mr. Chairman. So are there other entities that self-inspect their elevators or escalators?
I guess I can take that. So I do know Amtrak and the federal government self-inspect. They have their own inspectors. I know other transit properties throughout the United States do. I know New York City does, but I can't speak for Baltimore. I'm not quite sure how that works.
Okay, thanks.
Okay, Delegate Love.
Thank you, Mr. Chair. So since WMATA is a tri-jurisdictional operation, how does it work in DC and Virginia?
So I'll go briefly, and then if anyone else wants to chime in. So again, it's similar that we have oversight by WMSC, so they are overseeing the entire system. We do have a self-inspection program for our elevator escalator units in the district, in Fairfax and Arlington. So again, this is similar to what's going on currently across the system.
Okay, so it would just bring Maryland in line with how it's operating in the other jurisdictions.
Right, and actually, and how it was operating in years past in Maryland.
Okay, thank you.
Delegate Healy.
Thank you very much, Mr. Chairman. My question for WMATA. In the past, the elevators and escalators in the metro system in DC and in Maryland, throughout the whole WMATA system, have had a checkered history. Let's put it that way. There are many times. They're very long escalators and elevators that were out of service a lot. Has that improved in recent years? What is your rate of these facilities being operational or out of service?
So we currently, I believe we ended the calendar year with 95% availability on escalators and almost 97.9 on elevators. In 2012, we started a very large program to replace many of the aging escalators and take some of the old legacy fleet out. And we've actually dropped the average age of our escalators down from 29 years to right now it's just under 10 years. And we just signed another 7-year contract with a large escalator manufacturer to replace another 125 of the older escalators. So we've been doing much better recently.
Thank you very much.
And Delegate Healy, if I could just add on to that, the numbers Mitch just referenced are actually the availability, whether or not a unit is out because it has malfunctioned or something, or because we're purposely replacing it. So when we replace and take a unit out of service for rehab or replacement, we count that as an unavailable unit. So that's part of our number for the units that are not available to the public.
So only 5%?
Only, yes. And this is all reported actually also on our website.
Very good, thank you.
Okay, there appear to be no further questions. Let me go to the opponents to the bill: Frank Boston, Ralph Gray, Matthew Roosh, James Lowry, and John O'Connor. So let's start with Frank Boston, Ralph Gray on deck.
Yeah. Good afternoon. Can you hear me, Mr. Chair?
Yeah.
Good afternoon, Mr. Chair and members of the committee. I'm Frank Boston III. I'm here on behalf of the Elevator Industry Work Preservation Fund. And we are respectfully opposed to House Bill 886 as drafted. My members are here to testify and we'll give you more details. But our basic concern is safety. 2 years ago, we passed legislation to clarify that all elevators had to be physically witnessed by a qualified inspector. And that is a critical component to safety. This bill attempts to circumvent the passage of that law. The issue was elevators were verified. There wasn't a physical third-party inspector to do it. The way this bill is drafted, it will allow, to Delegate Wells's question, it will allow an in-house person to basically inspect themselves. That goes against the whole criteria, the whole idea of the passage of the law in 2019, where you had two sets of eyes working on an elevator, clearly, which is important, so that someone does not get hurt. We will work with the sponsor, to try to figure out a way that, it's not double regulation and oversight. But what is critical is that the third party inspector remains, because that's someone who's objective from the outside who can come in and make sure that these elevators are safe. Again, thank you for my time and ability to talk. We look forward to working with the committee in this regard, but as drafted, we definitely have to oppose this bill. It's an issue of safety.
Frank, at the very beginning of your testimony, I was distracted. Who are you representing?
It is the Elevator Industry Work Preservation Fund, and
Okay.
it's a coalition of both the companies as well as the unions in this space. And this is a bill that back in year 2000, we passed the Elevator Safety Code and have been improving it ever since. Thank you.
Okay, I'm going to take Ralph Gray next, and I do want to mention that I missed, but I now see the name of Joseph Demel, who will be the last individual testifying against the bill. So, Ralph Gray, welcome to the committee. You have 2 minutes.
Good afternoon to the members of the House Environmental Transportation Committee. My name is Ralph Gray. I'm a Maryland licensed elevator mechanic and a member of the International Union of Elevator Constructors. I've been in the elevator trade for 20 years. I have a QEI inspector license since 2013. I speak in opposition of House Bill 886, Public Safety Elevator Inspections Transit Compact Authority. Metro wants to change their escalator inspection oversight agency to an agency that's going to be a blanket agency that's going to cover the whole rail system in Maryland. And I think it should stay with the Maryland Department of Labor and Elevator and Escalator Safety Division, that is a specialized agency to handle all elevator and escalator oversight in Maryland. I also think that third party needs to stay. They have a non-biased objective. They're down there as an independent. They have no ties, affiliation with Metro or the state. And they also think that they should have the right to take a unit out of service if they deem necessary, not ask Metro if they can take it out of service. They should be able to take it out if it's unsafe. And I think that's very important to the Metro riders and for the state of Maryland. And any questions, I can take them.
Okay, thank you very much. We will take the questions after everyone has testified. Matthew Roosh, I suppose, and James Lowry on deck. Matthew?
Yes, sir. Can you hear me?
I can hear you. Did I get your name correct?
Rush. It's pronounced Rush.
Rush. Okay, go ahead.
Good afternoon, Mr. Chairman and members of the House Environment and Transportation Committee. My name is Matthew Rush, a business representative with Local 10, International Union of Elevator Constructors. I've spent 20 years in the field as an installation foreman for the IUEC. I'm also an instructor for the apprenticeship program for Local 10. I'm a resident of Maryland and have utilized the Metro Transit system my entire life. I'm here to speak in opposition of House Bill 886, Public Safety Elevator Inspections for the Transit Compact Authority. This bill raises grave concerns in the area of public safety. The riding public depends on the safety of these units to access Metro's transit system daily. I feel it would be a great disservice to the riding public to let Metro do their own inspections. This, in my eyes, would be a conflict of interest. In my years as an elevator constructor, third-party inspectors have been a valued asset. They have no vested interest in the units being inspected and given an honest and unbiased report of safety issues that need to be addressed. Although Metro may not agree with their findings in some inspections, I can honestly say they do a thorough job with the riding public's best interest at heart. Metro is not the only entity that has to deal with third-party inspections. The third-party inspections are also done at the airport, along with an airport authority inspector trained in elevator inspections. All GSA buildings are inspected by licensed GSA elevator inspectors and a third-party inspector. This helps maintain a type of checks and balances to ensure all units are inspected safely with integrity. To put this into perspective, there are reasons when you purchase a new home, the contractor that builds the home does not do the home inspections. They have a vested interest in the product. When we purchase an automobile, it cannot be inspected by the owner. This bill would allow just that, the proprietor to be the inspector. This is simply bad business practices. The state of Maryland has outlined.
If you could wrap up your testimony, the committee would appreciate it.
The state of Maryland has outlines in place, and they put them there for a reason, to stop things like this. We need to leave the checks and balances in there and not put the public riders in jeopardy.
Thank you very much. Next, James Lowry and then John O'Connor. Mr. Lowry, you've got 2 minutes. Welcome.
Good afternoon, Chairman Barve and members of the House Environment and Transportation Committee. My name is Jim Lowry. I'm an elevator mechanic and a member of the International Union of Elevator Constructors. I've been in the elevator trade for over 35 years and have been certified as a QEI inspector since 2005. I also sit on multiple ASME A17.1 code committees. A17.1 is the committee that writes the national codes for vertical transportation. I speak in opposition of HB 886, Public Safety, Elevator Inspections, Transit Compact Authority. This is about the safety of the public that depends on the hundreds of elevators and escalators that are in constant use in the metro system. While having an oversight agency is needed, it does not replace the importance of either a third-party inspections or inspections performed by the state of Maryland. Although the intentions of having thorough and unbiased inspections performed in-house are admirable, it opens the door for just the opposite. This would be no different than having Otis Elevator inspect their own jobs. Even most federal agencies are performing inspections on equipment that is maintained or installed by others. Most oversight agencies rely on the information and reports provided to them. In the elevator industry, we have found over the years that just because the paperwork is in order does not mean that the inspection was performed properly. This was proven in Maryland, where through legislation, all elevator and escalator inspections must be witnessed. Thank you for your time.
Thank you, sir. John O'Connor, followed by Joseph Demmel. I think you might have to unmute yourself, Mr. O'Connor.
Can you hear me?
I can now.
I'm sorry about that. Good afternoon, Mr. Chairman and members of the committee. My name is John O'Connor. I am the business manager of Local 10. I have been an elevator constructor for 30 years. I have worked in all areas of the elevator industry, including construction, maintenance, modernization, repair, and testing. I am also a Maryland resident, and most of my family is as well. My family and I have utilized Metro's transportation in one way or another for as long as I can remember. Elevators and escalators are part of a great industry that requires comprehensive training and education for the workers, regular and routine maintenance on the equipment, strong elevator safety laws and regulations on the companies and workers, and finally, annual safety tests performed by licensed mechanics and witnessed by trained inspectors. House Bill 886 would do away with the witnessing requirements of this annual test. So I am opposing this bill due to the factor of safety. My question is to you all, why anyone would remove an entity of safety from the riding public? Safety never takes a day off, and Metro runs 7 days a week. So why would you not want to collectively oversee the safety of the system for the riding public? I believe it is to our advantage to have such an entity in place to assure the safety of the system. Furthermore, the third-party inspectors are QEI certified as well and do thorough inspections of these units. House Bill 886 would not be good for Maryland residents and visitors to our great state.
Thank you very much. Joseph Demmel is the last witness.
Yes, good afternoon, Mr. Chairman and members of the House Environmental Transportation Committee. My name is Gene Dickinson. I was asked to come in and take Joseph Demmel's place. The weather, he lives out in Luray.
Okay, all right, go ahead.
He couldn't make it. Okay. And I've been a resident for Prince George's County for 70 years. I'm a member of Local 10, International Union of Elevator Constructors, for 42 years. In my career, I worked on the elevators and escalators in the metro system for 35 years for Westinghouse Schindler Elevator. I am speaking in opposition of Bill 886, Public Safety Inspection Transit Compact Authority. I have dealt with third-party inspectors and metro inspectors in the metro system my entire career. Currently, I work as a third-party inspector for Metro Elevator Inspection Services. We are required by the state to hold a QEI certification and a state license. To remove the third-party inspection from the Metro Transit system would be a mistake. Every job that third-party inspectors do are subject to a follow-up inspection by the state inspectors, which they do come behind us, and we have no idea when they're going to do it. We are held accountable by the state to do a thorough job and do it correctly. To give Metro Transit System free reign to do their own inspections would be a mistake. By passing this bill, you would allow Metro to set their own standards and allow what they see fit to slip through the cracks, rather than keeping an even standard for everyone. This will allow this would allow the safety standard for the Metro Transit System to decline with no accountability from any outside jurisdiction. The third-party inspectors allow for two separate agencies to rely on each other to hold each accountable and for the safe operation of our elevators and escalators. This is the reasons above that I have are against passing this legislation.
Okay, first question goes to Delegate Boyce.
Sorry, Mr. Chairman. Thank you so much. So I'm a little confused because I'm reading in the fiscal note that essentially WMATA, while it conducted most of its own Maryland elevator inspections under a memorandum of understanding with MD Labor, WMATA was still required to register its elevator units with the state and report on the accidents. And I'm assuming because now this MOU is expired, they don't want to even, I just want to make sure I'm clear that you don't even, WMATA does not also want to, under its past memorandum of understanding, provide the reports or register the units.
This is Charlie Scott with Metro. We can figure that out through amendment language, I think, but going back to that MOU would be fine with us. Right now, it's not possible under state law, but again, we'll work on amendment language that can recognize a way for the Department of Labor to continue conducting audits, including any accident reports related to our units. So we'll continue to work with the sponsor.
Right. Thank you so much, Charlie. And I also just want to understand a little bit more about no other jurisdiction does this. I mean, the fiscal note makes that very clear. And so, you know, I would say for, at least for me, it would be hard to grant such an exception, and whether or not this sets a precedent to the opponent's point about safety. If this is the precedent we set, and then everybody else wants to do this, what happens to the safety measures to ensure these equipment are working well? But most importantly, when I go into an elevator, that I don't just see the, you know, you're usually seeing that that Maryland Department of Labor sticker in the and for instance in an elevator, and it's like, you know, it's been inspected, and sometimes those stickers actually aren't 100% on par sometimes. I just want to assure the safety piece to all this, you know, with the double inspections and the inspections with someone on site watching the inspections. I mean, I think it is a concern, a safety concern.
Yep, Delegate Boyce, thank you for the question. Absolutely all neighboring jurisdictions and most in the United States require third-party inspections. This bill will do away with that. To the point, Mr. Charles Scott's point about the double regulation and an amendment to maybe only have them regulated by one side. We're entertaining an amendment, but the issue is, if there's no oversight on the third party by the state of Maryland, being a double regulatory authority, not sure how that amendment would work. We need to have that third party. It's something we fought to get in, and it creates the safety that is needed in the state, and as it with other neighboring jurisdictions. Someone else from my team maybe want to speak more on that.
Well, I would like to say that in the District of Columbia, Fairfax, and in Arlington, we do our own inspections, and they have, as we would agree to with Maryland, the right to come in and audit, and the audit can be during an inspection if they wish to do so. We're not opposed to that at all. What we're trying to do is be able to respond quicker to emergencies that we have in Maryland. And right now we don't have that ability. What we have to do is wait for the state of Maryland to come out, which we had some instances where it took them up to 6 days to get out to inspect a piece of equipment. So that's our issue. We want the flexibility. We're not trying to make it so that we can't be regulated. We're not trying to make it so that we're a rogue entity operating on our own. That is not where we're trying to go. So the MOU that we were operating under previously would be good language for us.
Okay, so then I want to take a step further, and I certainly understand wanting to the first there to get to the issue, and then potentially having the state, when it can get it there, to, I guess, certify your work. The question is WMATA willing to take additional liabilities should something happen, because there's an additional, there isn't an additional safety step to kind of monitor, kind of like put the second stamp of approval on this issue. And I think that's also the question. If you're willing to go this route, the question is are you willing to take on double the liability?
Well, as of right now, like I said, in all jurisdictions, this is how the other jurisdictions, this is how we operate, and we are willing to stand behind what we do and the work that we do. That's what we do every day in every other jurisdiction. And we were doing it in Maryland prior to 2019, when a law was passed that we had no idea was up. So we didn't get a chance to try to refute it.
Understood, but WMATA is willing to take the additional liability given that they're removing Maryland labor from this process? Because that's what on.
I think I understand the question. So, I mean, just so that members of this committee understand, Metro is self-insured, but we do carry insurance for major catastrophic events. But I think that also lends to the reason that we have a robust inspection program, because it is in our vested interest for our riders, but also from a liability perspective, that we have a very safe system. So that's one of the reasons that we actually set up a robust, independent safety inspection program.
Thank you.
Any other questions? I don't see any other questions. So thank you very much, Delegate Lewis. This ends the public hearing on House Bill 886. We're going to turn now to House Bill 912, Delegate Lasanti.
Thank you, Chairman Barve and Vice Chairman Stein, members of the committee.
And you get 4 minutes, by the way.
Excellent, thank you. Delegate Marianne Lasanti for House Bill 912. This is an emergency bill. It is to address a law passed by this committee in 2018. That bill was Senate Bill 973, sponsored by Senator Mano, and the House bill version was sponsored by me, House Bill 963. And that bill, that law actually is due to sunset May 31st of this year. House Bill 912 that is before you today extends the sunset of the law for 3 additional years. So this bill would then, the law would then conclude on May the 31st of 2024. I would like to acknowledge, if I could, Delegate Al Carr for his work with me on this bill, because both of us share major transportation facilities in our districts. For me, the Hayden Bridge and the Tidings Bridge, and for him, the ICC. I'd like to refresh the memory of the committee, as well as for the benefit of the new members, what this bill is really about. It does a few things. Number one, it authorizes the MTA to recall delinquent accounts from the state central collections unit. It authorizes MTA to waive civil penalties assessed by the CCU for non-payment, problems with video toll devices, or mitigating factors. It also gives MTA the flexibility to be responsive to the needs of customers and also responsive to us when we get customer complaints. I'd like to note that MTA has submitted a letter of information that speaks favorably to how this legislation has been implemented while it has been law. And so given the financial hardships that many Marylanders are facing because of COVID, I request a favorable report on House Bill 912. Thank you, Mr. Chairman, members of the committee.
Thank you, Delegate. Any questions for, they're signed up in opposition to the bill. Any questions for the sponsor? Okay, you're free to go, Mary Ann.
Thank you all very much.
Okay,
Have a good day.
You too, let's turn to Delegate Wells, House Bill 945.
Thank you, Mr. Chair. So actually, well, 945, I meant to withdraw. I had a drafting error. So if you might see on the agenda, the bills are almost identical.
Yeah, I was going to ask. You want me to just withdraw that one?
Yes. Yep.
Okay. Well,
so 947.
In that case, let's go to 947. And Uriel, if you can reset the timer, that'd be great.
Perfect. Okay. Thank you, Chair Barve, members of the committee. For the record, I am Delegate Wells, and I'm here to testify on HB 947, which aims to eliminate crucial barriers for opioid treatment programs, patients seeking treatment. So I had this bill before you last year in a different posture. And in those conversations, there was a big piece that came out around making sure that the providers would be able to issue the identification cards, because otherwise the patient would still have to go down to MTA to do it. So we really would not have been removing the full barrier and getting their reduced fare. So this bill focuses, sorry, there's some background noise, but this bill just really focuses on that. There is the fiscal note, and I am working with the stakeholders to perhaps establish a pilot program that would just be for Baltimore and would only allow, I believe, no more than 10 providers, but we probably will only limit it to 2. So we're hoping that we might be able to get that issued so we can see what the fiscal impact would be. But we do not intend to have a supply statewide. I know that the fiscal impact was raised in the informational letter from MDOT. So with that, I urge a favorable report.
Thank you very much, Delegate. We also have testifying in favor of the bill, Kevin Pfeiffer, former Delegate Bilal Ali, and Andre Pellegrini. So let's go to Kevin Pfeiffer. Kevin, welcome to the committee. You have 2 minutes. Or not. Okay, why don't we go to former Delegate Bilal Ali. Bilal, welcome to the Environment and Transportation Committee. And it looks like his audio is connecting. Bilal, if you can unmute yourself, please proceed. You have 2 minutes. Welcome back.
All right, thank you, Mr. Chair. First of all, my name is Bilal Ali, and I'd like to give you a little background, personal background. I'm a licensed clinical professional counselor and a licensed clinical alcohol and drug clinician. I've worked in this field for over 25 years. I think, and I also want to thank the committee for passing the bill last session. This current bill is presented with technical language. I'm quite sure we're all aware, besides COVID, we still are in the midst of opioid epidemic. And I think what this bill does is give patients access to treatment. Now, last session we had patients came to the committee and testified what was the challenges that were associated with getting to treatment. Now, we have to understand that OTP programs require patients to go to the program every day. The other thing that I want the committee to understand is that the process, the initiation process, starts with the OTP programs. It doesn't start with MTA, it starts with the program. And so I think in the midst of an opioid epidemic, I think we should be trying to have additional tools in our toolbox to address some of those barriers that patients are facing. And we're willing to work with the sponsors if in fact you deem it appropriate to start a pilot program so we can get some data so we can make data-driven decisions.
Well, thank you very much, Delegate.
Thank you, Chair.
Thank you very much. Hey, before I let you go here, I'll stay on, but you're representing CMDS, Delegate Ali. If you could please tell me what that acronym stands for.
Clinical Management Development Service.
Okay, well, that seems like a sensible name for what you do. Okay, next let's go to Andre Pellegrini. Andre, welcome to the committee. You have two minutes.
Thank you. Mr. Chairman and members of the committee, my name is Andre Pellegrini. I'm the VP of Finance and Business Development for CMDS. Transportation is the #1 barrier for patients to access substance abuse and mental health treatment. Even before the pandemic, access to treatment was a major issue for our patients, but COVID worsened the situation even more. Roughly all our patients many patients in substance abuse programs have to take buses to go to the clinics to either take their medication or do mental health or do their counseling. Mental health and substance abuse conditions are very serious in Maryland. In 2020, there was a 12% increase in the number of overdoses in Maryland compared to 2019. Suicide is the 3rd leading cause of death in Maryland for people ages 15 through 34. And 100% of people who committed suicide either had a mental health diagnosis or a substance abuse condition. Creating ways for patients to access treatment can actually save lives, and Bill 947 achieves just that. We will work with the sponsors and the committee to move forward, even if that means, as Bilal mentioned, creating a pilot program. Thanks for your time. I urge a favorable vote for House Bill 947.
Okay, and is Kevin Pfeiffer around? He signed up and I don't think he's here, so, okay.
Mr. Chair.
Yeah.
He said he was not let in.
Oh, Uriel, is there anybody waiting in the?
Yeah, Mr. Chairman, he just showed up. I just let him in.
Okay, Kevin Pfeiffer, I see your audio is connecting as we're talking here, so I will wait for you a little bit. And Mr. Pfeiffer, if you can unmute yourself, welcome to the committee. You have 2 minutes.
Okay, thank you very much. I don't know what happened before, but I guess it doesn't matter. Can you hear me?
I can hear you. I can't see you, but that's good enough. I can hear you.
Okay. I hope I hope it's worth the wait.
Yep.
Anyway.
Yep, I can see and hear you now.
Okay, thank you, Mr. Chairman. I'm Kevin Pfeiffer. I'm the president of something called CMDS, which stands for Clinic Management and Development Services. We primarily provide administrative services to behavioral health programs. We also have an intensive outpatient program and an outpatient program ourselves, and expect to be opening 2 significant residential care facilities in Baltimore this year. The services we provide for Turning Point, which is an OTP, that's really why I'm here speaking to you today. My company does not get paid on the basis of the number of patients, the profitability of Turning Point, or anything like that. We provide payroll services and HR, IT, custom software, billing, credentialing, and so on. So I don't have a financial dog in this fight. Providing discounted bus passes to these patients is critically important, and I would encourage everybody not to take too seriously the MTA fiscal note. Providing these bus passes through OTPs, it means that OTPs will be retailing those bus passes. By that I mean the MTA will no longer have to have patients show up at their facility where the MTA does all the paperwork, the processing, issues the photo IDs and so on. This will actually save them money. The MTA, I'm sorry, but the MTA simply doesn't want these people on their buses. We have been trying to get them interested in this for going on 5 years now, and I would simply encourage everyone, do not take that fiscal note too seriously. It will save money. Keep in mind that all these patients are eligible for Maryland mobility already. I believe my time is up, but just please take this very seriously. It's a small thing that would mean a lot. Thank you.
Right. We take all the bills before us seriously. I will say that just looking at the list right off the bat, nobody's signed up in opposition to the bill. Now, I will read the written informational testimony from the Department of Transportation, but nobody's signed up as opposed or even favorable with amendments. So any questions for the supporter, the sponsor, or the witnesses supporting the bill? Okay, well, that appears to be it then for House Bill 947. And that concludes the public hearings for today as well. So do we have any announcements from subcommittee chairs? Nothing, really? Okay.
Mr. Chair, I think Delegate Fraser Hidalgo may have, he could very well still be over in ECM. We just left there. And I think that we are supposed to meet immediately afterwards.
Well, I'll tell you. Yeah, why don't somebody text him and have him just stay on here. Let me, of course, I was in the middle of texting. This came, hold on. Just, let's call the man up and see what he's up to here. Hey, our public hearing just ended. When do you want to do your subcommittee? Well, just give me a time and I'll announce it to the committee. I'm on Zoom with them right. 3:45. Okay, great. Thanks a lot. Okay, 3:40. Transportation will meet at 3:45. So them's our marching orders. So see you tomorrow. Stay safe and